It is Health Diary. Thank you for making time. My name is Gladys Gashanja and we're coming to you from the Eastland Hotel here in Nairobi. Now, this condition has been described as a silent monster that torments women and girls. Now, despite endometriosis being as common as breast cancer, it is highly misdiagnosed and highly misunderstood. So today we shed light on this condition that makes that monthly occurrence unbearable for many women and girls. But before we get to it, here now is a fact of the matter. Endometriosis is an often painful disorder in which tissue that normally lines the inside of your uterus grows outside your uterus. The condition mostly involves the ovaries, fallopian tubes, and the tissue lining your pelvis, but can also spread to other parts of the body. It takes an average of 10 years for women to be diagnosed with endometriosis, as it's often mistaken for other conditions that can cause pelvic pain. There is no cure for endometriosis, and surgical or medical treatments remain the most effective methods of managing the condition. Timely diagnosis can enable proper management of the condition, giving the patient a chance at a quality life.
The pain started when I was around class 7. I first had my periods in class 6. So that time I ran my periods for 3 months. Constantly, without knowing. I used to think that once you've started your periods, it's supposed to go on for a lifetime. Until my mom one time, she found me in my room changing my pad and she asked me, "You're not done?" And I'm like, no, bado haijaisha. Kwani inafaa kuisha? Akaniambia tutaenda hospitali kesho. So we went to the hospital. I got checked. That's when I started another hormonal therapy. That was the first time I was on hormonal therapy. So my periods got regulated to around 5 days. But once it got regulated, that's when I began having crampings. I remember there was a night prep one time. I was in class, I was in pain, I was crying. People could look at you, but they couldn't help because, the strictness of the school. So I could just stay there, cry in pain because I couldn't go to the nurse because sometimes, they could say that, you're pretending. I've already given you painkillers, those are the strongest painkillers, but sometimes, they just don't understand the fact that I'm in more pain. I need something more to help me. Then I was diagnosed with endometriosis stage 2. There's this myth that when you get pregnant and have a baby, the symptoms reduce or the endo disappears. So being 19 and it's just like, wow, where can I get a man who's going to give me a child, a man who's going to father my child, a man who's going to fund my child and me? It was so much to take in for me. The hardest part has been seeing my mom looking at me anytime I'm in pain, seeing her struggle, trying to help me as much as she can. You learn to laugh through the pain. Really discovering endo at an early age instead of just listening to people, trying to see that gynecologists are quite expensive. I think it's just a matter of taking that risk or taking that opportunity to know what's going on with your body.
So let us unpack endometriosis, that is commonly abbreviated as endo. And to help us do so, we have Dr. Nelly Basira, who is a gynecologist, and we have Beryl Akinyi Okech, who is an endo warrior. Thank you, ladies, for joining me. Now, let's start off by defining what endometriosis is. The endometrium grows outside the uterus. What is that and what causes it?
This right here is our normal uterus. And our normal uterus has 3 layers. So we have the outermost layer, which we call the serosa, and this basically just holds everything together. Then we have the middle layer right there. This is the muscle tissue, and this is what contracts during labor to expel the baby out. And this lining is very unique. It's the endometrium. And what's unique about this is that it's very responsive to hormones. This is basically what our monthly period is. So in endometriosis, we have this tissue growing outside of this cavity,
Which is the endometrium.
which is the endometrium. The black dots are a representation of endometriosis. If it's growing right out of the cavity of the uterus and into the muscle, we call that adenomyosis. When it grows right outside, it can be, as you see right there on the tube, it can be on the ovary, it can be in the vaginal canal, it can be right outside, it can be outside of the uterus on the uterine wall, and it can actually grow outside completely of the reproductive system on gut. It can go to the liver, it can go to the lung, anywhere in the body. So the most important thing to remember is that it doesn't matter where it is in the body. Every month it's going to respond to your hormones the way it would if it was inside the uterus.
So are genetics at play here in as far as who is susceptible, or just being a woman makes you susceptible?
Being a woman makes you susceptible. And as I said, one of the things we haven't quite understood is what causes endometriosis. Why does it happen? So we have had a few theories that try to explain. One of it is that when we are having our periods, as the periods are supposed to pour out right through the cervix, sometimes some of it might reflux through the tubes and spill into the cavity. However, what then that theory fails to explain is that in every cycle, 80% of women will actually have this reflux. So why is it only a certain percentage of those will still get endometriosis? So once the abnormal tissue is in the wrong place, the body's immune system senses that this isn't supposed to be here, and it tries to clean it up. And that's now the inflammatory process. So some people are more prone to inflammation than others, and there is the genetic issue. That for some it will be such a violent reaction to this abnormal tissue causing the symptoms that we see, and for some it might not be so much, and they can just peacefully clean up the mess and not necessarily develop endometriosis.
Okay. All right. So for you, Beryl, you've been treating endo for the last 2 years.
Yes.
What exactly brought about the symptoms, or how did you connect that that's what you were dealing with?
First, in 2017, I got pregnant and I miscarried within 3 weeks. When I went back to my gynecologist, he only said that the baby isn't ready to be attached. So after that, he gave me medicines to wash out the damage. Later on, I got pregnant again, but this time I got miscarried at 2 months. Now I got worried, why am I miscarrying, yet I'm getting pregnant? So I had to change another gynecologist. There was a neighbor who works in a hospital. One day, one time came to the house to visit. He found out that I had collapsed long ago. When they rushed me to hospital, I was found that I was having flares of ovarian cyst. In between this surgery, that's when they found out I had endometriosis. I've done 3 laparoscopy surgeries, but there is no change. The only thing that doctor told me is I should go to Romania and have excision surgery, because there is no need of me going to hospital always, and I'm suffering. And then my endometriosis has reached to intestines.
What she's talking about also alludes to the pain that it comes with, the severity of it. But this happens during menstrual cycles for most of them, but some it's during pregnancy. Why the discrepancy?
The severity of symptoms doesn't always correlate with the severity of the endometriosis. So you will find people who, when you open the abdomen, looks fairly clean, but they have intense pain, you know? And when you think about that, then that also means that treatment options are as varied as they come. Adenomyosis patients get a lot of pain because what's happening is that you're bleeding inside muscle tissue, as I had demonstrated earlier, but that muscle tissue has no space to accommodate that flow. So there's a lot of pressure in there, and when the uterine muscles are triggered by anything, they contract very, very intensely trying to expel it.
When you look back in your adolescent years and maybe just during your menses, did you have severe pain? Did you have the bad cramps, as we call them?
Yes, I had bad cramps, which usually I would take Buscopan. But after this surgery of ovarian cyst, it got worse. Because me, most of the time when I'm in pain, I usually don't walk. Mine is bad like that. I don't walk. At times I can't go to the toilet. That 1 week before actual date of periods, I usually don't want to talk to anyone. I usually just cry on my own because I always say some people don't understand my pain.
The pain can be incapacitating, literally, but definitely there are other symptoms that are also as intense. Pain during intercourse, yeah, which others?
Some of the deposits can actually be in the vaginal canal itself or just above the vaginal canal in the lower part of the pelvic cavity. So during intercourse, because of that pressure and touch, it is extremely excruciating. And then there'd be abnormal bleeding. Some people will literally not have a period. They literally bleed almost every day of their lives because a lot of things are messed up. The cycle is completely messed up. The endometrial lining is completely messed up. One of the commonest reasons a lot of people will end up being diagnosed is when they're having difficulty conceiving. And this is a very almost assured that the longer you have endometriosis, the higher the risk of developing infertility. Because as we said, when you're having all this inflammation, then there is ongoing formation of scar tissue. And this scar tissue within the pelvis is now distorting the pelvic organs. Sometimes it's actually a chance finding. There are people with severe endometriosis and have no symptoms. Then you go in there for a different surgery and you're like, what am I finding? You know, there are symptoms outside of the reproductive tract. As she said, for instance, hers, when it starts to spread to the gut, it can cause intestinal obstruction. When the tissue is in the lungs, for instance, and every month somebody's wondering why I'm coughing up blood, because then they bleed during the cycle. And then, of course, the lung is flooded with blood that shouldn't be there, that's getting coughed out. We've had very unique cases reported around the world, endometriosis in the brain. And so somebody then bleeds into the brain cavity and you're wondering, why do you have a hematoma in your brain? And it's upon surgery that you discover, oops, it's not just a hematoma. You remove the blood, but then there is tissue sitting there that should not be.
This condition is misdiagnosed to be irritable bowel syndrome, among other things. Doesn't this now fuel the rates of misdiagnosis we see?
On average, we see that it takes about 14 years for somebody to actually be handed a diagnosis of endometriosis. So you can imagine if you have a teenager who complains from the age of 13, they're going to be told they have endometriosis on average about 25, 27 years. We've heard about hormonal imbalance. We have heard about, for the poor adolescents, always being told it's teenage. And I think that's just probably the saddest bit about it, because endometriosis happens in the reproductive age. So we are looking at how do we then improve the diagnosis. However, one of the challenges that has really driven the misdiagnosis, even the challenge of doing the actual diagnosis itself. We're safer having a possible diagnosis being taken care of, rather than saying, I don't think it's endometriosis because I don't have actual evidence of it. And then we have, of course, the complications setting in because we ignored it for far too long.
And some doctors have said, get pregnant now because life is about to get complicated. Is that advisable?
Knowing the way the disease behaves and what we then expect of it to do in the body, then we know that the longer you have the condition, the higher the chance of developing infertility. So we have to be very honest with the patients and tell them that, look, you could conceive at the age of 35 naturally, but your percentage of capacity to get pregnant at that age compared to a woman who doesn't have endometriosis is far lower. In the event that then conception becomes a challenge, the younger you are, the better the outcome if we really have to intervene with more complicated techniques like assisted reproductive technology.
Does pregnancy alleviate the symptoms of endo?
For the duration you're pregnant, yes. Because remember, as we said, that when you're bleeding is when you're triggering the whole inflammatory process. So during pregnancy you don't bleed. So wherever endo is sitting, it's not bleeding.
Burial. They talk about some of the risk factors are never giving birth or starting your periods early. Did you start your periods early?
No, I started my periods when I was 16 years old.
Do you have anyone in your family who deals with endo?
No, I'm the first one.
Anyone who's struggling with infertility?
No, I'm the first one.
Okay, so she's a classic case of being the first in her family. What are some of these other risk factors that actually can speak to endo?
It is a condition that's happening within the reproductive age. So if you start your reproductive career much earlier, it means that you have a longer time of being exposed to the ups and downs of the hormones, and therefore are more likely to be developing this condition. That's how the age factor applies. Having delayed reproduction in terms of not having babies earlier might not necessarily be that direct, because a lot of people are able to delay childbearing because they're using contraceptives, and contraceptives are a form of treatment for endometriosis. So you'll find that that might actually mask the symptoms of something that was always there anyway. And at the point where somebody goes off contraceptives and is trying to conceive, it might be the first time that they're actually seeing the symptoms, and that might actually even delay when they first diagnose the symptoms.
One of the complications, again, infertility. 6 years, you've been trying to have a child, you don't have a child, endo comes with stigma.
First of all, me, when I was diagnosed with ovarian cyst and endometriosis, I first had to lose my both fallopian tubes and my left ovary. Endometriosis went with all of them. Now I'm stuck with right ovary alone. I'm one person who's an easy goer with people, but when someone asks you, "Mbona hujaza umeolewa for the last 6 months?" me, I always avoid that. There was a time I even avoid going to church because of that. Someone asked me in church, why do I pray and I can't have a kid? So for the past 2 years I didn't go to church. I've returned to church this year. Now, these days, we don't go to meet families at all because I can't stand my hubby being asked questions that are misleading him. We decided this is us, this is our battle. Yes, but stigma, it's there.
Well, there is life after endometriosis, and treatment has made it way easier to actually manage this condition. What are some of the treatment options, Dr.?
The longest standing has always been use of hormones, because the whole idea is that hormones are the ones that cause this cyclic bleeding. And so how do we manipulate them to put on hold the cyclic bleeding? The second line treatment has been what we call gonadotropin releasing hormone antagonists or agonists. This is the hormone we make in the brain that triggers the entire reproductive cycle that is made in the brain, and so in the hypothalamus. So what we do is then we try to cut off its effect. And the moment you do that, you basically sort of temporarily place the woman in menopause. But in as much as possible, we're saying surgery is not your first line. We need to minimize it as much as possible. Sometimes even removing that uterus doesn't necessarily take care of the pain. The ultimate cure is menopause.
Let's talk about the cost burial.
These surgeries make person go bankrupt because there is no medical cover that is taking care of it, and at times NHIF varies. Me, on my cases, like last year, I had friends who did Arambe for me to go for my third laparoscopy surgery.
I'm just wondering, she has access to treatment. There's somebody in the machinani who does not even have anything to their name. What happens to them?
Some of the procedures we do, some of the tests we need to do are the same as when we're doing for infertility. So when you're asking an insurance to cover a patient for certain tests and say, we don't treat infertility, and we're like, look, this isn't about infertility, it's about endometriosis. It's ridiculously unfair. And that means that the poor person then has to really suffer with this condition. So some of our really good surgeons have invested very heavily to learn this skill on their own. So when they come back, you have this skill, you work in a public hospital, it doesn't have a laparoscopy tower. The only place you can get a laparoscopy tower is in a private hospital that has gone out of its way to put up this equipment. And so you have to take the patient there and you don't dictate the costs. So there's the cost of the doctor and there's the cost of the hospital to the patient. And this really just puts it out of reach.
Now, when it comes to nutrition, it has said to relieve some of the symptoms of endo. Has anything worked for you?
I was told to cut off sugar completely. I don't take meat. I don't take wheat. I don't take anything, coffee, caffeine. I don't take anything because in our condition, endometriosis, most of the time we do heavy bleeding, and Milo and chocolate triggers this bleeding. So most of the time, me, I'm comfortable taking hot water with honey.
Anything that affects or modulates how the immune system works is definitely then going to affect endometriosis. So we can have a blanket statement that says that certain foods should be avoided, and also we're different. So you might find that dietary control might work for one person, it might not work for the next person, and we have to establish what is it about the diet exactly is causing the trigger. Wheat, for instance, is fairly easy because gluten, which is in all wheat products, is something that there are people who are allergic to eat even when they do not have endometriosis and have to stay away completely. And the way it causes irritation is actually by fostering inflammation within the gut. So if the same gluten is triggering inflammatory processes in the body, then obviously for somebody with endometriosis, it might make it worse.
Beryl, having walked in these shoes of endometriosis, what would be a clarion call for people who don't understand this condition?
Me, most of the time, I always tell my friends they should come at least once in a while and stay with me when I'm having my periods and see what I'm passing through, and then they judge me from there, because you can't force everyone to understand you.
Dr. This is almost as common as breast cancer.
This is to every mom who's telling their daughter, I was just like you, and when I had children, it went away. It's not normal. This is to my own colleagues who see patients with period pain. Give them a shot of painkiller and send them home and tell them, you're going to be fine, you're going to outgrow this. It is not normal. Because telling me period pain is normal is then saying that those who have painless periods are abnormal.
Dr. Nelly Basire, thank you for your time. And of course, Beryl Akinyi Okech, thank you for telling your story and being very candid about your circumstances. Endometriosis affects 1 in 10 women. It is a reality, and a lot of attitude change is needed in dealing with this condition and supporting those that live with it. Time now for the health tip.
Health tip brought to you by Good Life Pharmacy.
We have wipes for you to use during the day, because not every time that you'll be able to have water to keep cleaning your intimate area. We have got different tampons, and especially is the teenage tampons, which are very small, especially for a beginner. We've covered even the mothers who've given birth. We've got them in maternity pads. Also, we have got the premenopausal pads. Sometimes the flow is light, other times the flow is heavy. Panty liners, which are cottonish, meaning that they don't cause any kind of irritations on the skin. And you can get all this at all our outlets at Good Life Pharmacy, and we are all about you.
Health tip brought to you by Good Life Pharmacy.
A very informative conversation today on Health Diary. Thank you for your suggestions coming through on our social media handles. My name is Gladys Gashanja. We've been coming to you from the Eastland Hotel here in Nairobi. See you. A very, very informative conversation on Health Diary today, even as we understood more about anime starter. Come back here. Okay. Yes, it is Health Diary. Thank you for making time. My name is Gladys Gashanja, and we're coming to you from the